Hi, welcome to Reading with Rocco. I'm just sharing with you some of my favorite books from my personal collection at home, and I'm reading short passages with you. This book I want to share today is one of my favorites. If Woman Ruled the World, If Only. It's edited by Sheila Ellison, and it's a great collection of essays, thought-provoking, thoughtful essays by women from all different disciplines, all different careers, from all over the place. And it's very, very interesting. And I'm going to share one with you right now. Matter of fact, I'm going to probably share a few essays with you in different video segments from this book because I really like this book. Okay, the first essay I'm going to share with you is written by a woman named Jackie Regales. And Jackie Regales is a teacher who lives in Baltimore, Maryland. I happen to love Baltimore, Maryland, because I have family who have lived in Maryland for many, 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 many decades. And they started out in Baltimore before they moved to the suburbs in Maryland. So anyway, the first essay is, if woman ruled the world, we would all have health care. Isn't that the truth? She starts out her essay with a quote from Eleanor Smeal. There is no question in my mind, but that rights are never won unless people are willing to fight for them. Amen. So, Jackie Regales goes on to say, for me, living without health care has become just another part of my life. I no longer wake up in the morning and think, please don't let any of us get sick today. But I do still think of a doctor's visit as an unthinkable luxury, only for emergencies. In the year that we've been without insurance, we've been very lucky and have only had to pay for routine visits to pediatricians and general practitioners, no specialists needed. Whew. I no longer have nightmares of broken bones, piles of hospital bills, whispers in my ears of foreclosure and bankruptcy when I awake. But then something will remind me, such as the receptionist asking if our status has changed. And I have to shake my head no. Or I have to explain to someone yet again that my 2 jobs, combined with my husband's temporary work, adds up to just enough to make us not technically poor, and yet none of these part-time jobs come with insurance that costs less than $900 a month for a family of 4. It is inconceivable to me that there are so many people like us who are working incredibly hard and yet lack basic necessities of life. It is incomprehensible that businesses are allowed to have the majority of their workforce be part-time or contractual or temporary or whatever euphemistic term they choose for a job with no benefits. One of my jobs requires a master's degree, the other not even a high school diploma, but neither offers a retirement plan, sick days, or health insurance. For a country as proud of itself as we are, as insistent that we are the world's superpower, what kind of security do we offer our citizens? How can we expect to have a healthy, educated, optimistic population if we make no real efforts in that direction? Why are there still women and children dying city blocks away from the greatest medical institutions in the world? There are countries in this world where every citizen is insured from birth to death. How amazing it must be to take that for granted, to have that security, no matter who your parents are or what job you have. Yet even in these countries, many non-citizens are denied health care by virtue of their place of birth, as if they are somehow less deserving. Who decides who gets to live or die? I trust female leadership would begin to solve this problem. Women are generally the ones who see and suffer from the ravages caused by a lack of health care. We are the ones caring for elderly relatives who can no longer afford their prescriptions. We are the ones hoping the childhood fevers don't turn into coughs, which can turn into colds, which can turn into pneumonia we can't afford to have diagnosed, much less treated. We are the ones with unnoticed limps, sprains that never healed, teeth that ache off and on for years, back problems exacerbated by the pink and blue collar jobs that require hours on our feet. We are the ones who watch our partners leave the house each day and come home with mysterious bruises, trouble breathing, and missing fingertips. Healthcare should be a gift to each citizen of the world and should not stop or start with a paycheck. No mother should have to worry, as I do, about keeping her family healthy and safe. That is from Jackie Regales, a teacher from Baltimore, Maryland. And truer words have never been written.